Thank you so much for the introduction, Tony, and of course to GBC Mauritius for the invitation to join you all today. It's a pleasure, first of all, to be able to deliver an introductory presentation about health and well-being in the built environment, then to be able to share some work that myself and my team at World GBC are working on around health and well-being, and to participate in the discussion today. So looking forward to it. Thank you. Now, as Tony said, my name is Catriona Brady. Don't be fooled by the O in the middle. It's the mysterious Scottish spelling. We pronounce it Catriona here. And I'm head of Better Places for People, which is one of the global projects of the World Green Building Council. And I also lead strategic planning for the organisation. So I'll begin with a brief introduction to that before we get into the health and well-being work. So the World Green Building Council is a global membership organisation. We're a network of around 70 national green building councils, each of which has their own membership, all dedicated to our mission of green buildings for everyone, everywhere, and currently representing around 40,000 organisations around the world. So it's wonderful to speak to so many GBCM members today and to be able to put this into the global context of the entire network. Now, as some of you may be aware, the World Green Building Council launched a new strategy at the beginning of this year, our next 3-year strategy for 2020 to 2022. And as you'll see at the bottom of the slide, we've taken the opportunity to align to the goals and the targets and indicators of the Sustainable Development Goals. And with this piece of work, what we recognised was that although, of course, all 17 goals do, of course, have relevance to the built environment, we felt that there were 11 that our network could particularly strongly impact through our work, and boiled down those 3 areas of work are climate action, health and well-being, and resources and circularity. So I, of course, will be focusing on the health and well-being work. That's my area of expertise at World GBC. And within our health and well-being work, we have a global project which has been operating for over 5 years now. Now, this project is called Better Places for People. It's actually being participated in actively by around 30 countries on the steering committee, which is an incredible breadth of knowledge and diversity of countries to have, all working towards our mission of healthier and more sustainable buildings and communities. Now, of course, it would be remiss of me in the introduction not to frame this within the current context of the coronavirus pandemic. And of course, right now is a particularly interesting and important time to be talking about the built environment, because we're all spending so much time within our homes where we are around the world, all united in the same degree of lockdown, although different strategies from different governments. And I'm sure the question in many of our minds is, what will the future be for public health, and what are the lessons for built environment professionals like ourselves? And so it's a pleasure for me to be able to share some of the thinking of World GBC around health and well-being generally to stimulate some of this discussion. So in my introduction, I've been asked to kick off with a bit of a thought about the link between health, well-being, and the built environment. I've shared the image of SDG 3, good health and well-being. As many of you know, the UN and the member countries have identified that health and well-being is one of the 17 areas of sustainability that we should all be focused on working on. Now, I'm going to begin by putting this into perspective of indoor health, but I'll also touch on outdoor health and well-being factors at the end of this short introduction. But this is a slide that I like to share because usually when we do presentations, I find this statistic really shocks people. Now, evidence that some of you might be familiar with, it's actually American evidence from the University of Berkeley, that most of us in the developed world spend 90% of our time indoors, whether that's homes, schools, offices. We obviously spend the vast majority of our time in buildings, and even more so at the current time. But I always find this statistic tends to surprise people, because when you see it numerically, it really comes to life of how much time we actually spend indoors, and therefore how important our indoor environment must be and directly impactful to our health. Now, the other half of this 90% statistic I like to share is putting this into a commercial setting. Now, the average organization spends 90% of its overhead costs on its staff, according to research that was published by the World GBC in 2014. So one of the very interesting things about this is if you recognize that as an organization, your major outgoing is on your people, then really it provides a business incentive to create a healthier and more sustainable built environment if you can create this built environment that helps to enhance their health, reducing sickness, reducing staff turnover, potentially increasing productivity and reducing people being absent or not really focusing well, just presenteeism in the workplace. Now, we've tried to illustrate this fact in a number of ways by collecting and sharing research over the past 5 years. And I'm sure Shalini will be able to share more on this because the Well Building Standard have done a huge amount of work on this area as well. But 3 statistics that I like to show that really help to illustrate this from some different building typologies is, firstly, our friends at the Harvard School of Public Health have shown that when we're in buildings with better air quality, people's cognitive functioning and their concentration and their ability to work well substantially improves. And that was shown in office workers who recorded 101% higher cognitive scores. Additionally, in office environments, studies have shown that where employees have good views, particularly of nature and access to daylight, it has a benefit on their body clock, their circadian rhythm, and that can be directly attributed to a reduction in sick leave, which of course has these financial benefits again. And thirdly, I like this statistic because it takes the pattern into a different typology looking at hospitals, but an American study has shown that when people have access to views of nature and green space within their rooms, that actually people heal on average half a day faster. And that if this was to be extrapolated across a nation, it could represent a benefit of $93 million. Of course, that's hypothetical, but I think these really show the potential power of harnessing health and well-being in the built environment as a value add. Now, this is something the World GBC has been really devoted to sharing over the past 5 years, and I'll just highlight here that there are a number of case study reports that really bring to life these patterns with detailed outlines of some case studies that have these health, well-being and productivity benefits. And also an invitation to you all, we now have on the World Green Building Council website a live case study library. This is a screenshot from it. This is what it looks like, but the numbers are going up every day. We have over 150 case studies live, and it's been going for 6 months, where you can see some of the best in class examples of both healthy and net zero buildings. And we would greatly encourage submissions of any buildings that would meet the criteria for Mauritius. It would be brilliant to be able to share these. So please see the World GBC website. You'll find it by Googling or searching World GBC Case Study Library. Now, just to wrap up my initial presentation, I want to give a focused example on one area of health and well-being. And this is an area we're doing a lot on at the moment at the World Green Building Council, and that's around air. Now, when I'm talking about air quality and the built environment, I think it's important to resonate the fact that air quality is impacting our health both when we're outside and when we're inside. And some of these statistics I often find quite startling, that across the world, polluted air is causing 7 million deaths each year, and that actually 90%, over 90% of the population live in areas that exceed safe levels of air pollution. So although these health and well-being factors may not seem directly attributable to everyone, when we boil down to a focused example like air quality, it's more likely than not that we are some of the people who are experiencing these unhealthy levels of pollution, particularly if you live in a more urban area. And just to illustrate this a little more, I think it's important for us to look at the impact that the building and construction industry has on these specific health factors. With the example of air pollution, looking just outside, looking just at outdoor ambient air pollution, there are so many ways the building and construction industry is contributing to pollution that often we don't think about because it's often transport or agriculture or waste that makes the headlines. But energy generation, construction, the way we heat, cool, control temperature within our buildings and maintain comfort can be ways that we're inadvertently creating other health impacts for people and of course the planet as well. And with that, I'll just wrap this up as with a couple of statistics to illustrate this and bring this home, that so often when we talk about health and well-being, we are talking primarily from the view of the occupant. But as I will talk about in a second when we go on to talk about these frameworks, one of the things that we're doing at World GBC is really trying to push ourselves to look beyond this initial scope, this focused view of the occupant of the building. So with air quality, yes, we're looking at people, but we're also looking at the planetary health issues and the impact that's caused on building or appropriate building strategies to allow them to perform sustainably. So I'll wrap this up there. I could quite easily go into more detail, so we can come back to this later in the discussion if anybody wishes, but it's been a great pleasure to kick off this introduction. So Tony, I'll hand it back to you.
Thanks. Thank you, Catriona. It's great that you painted a picture how healthy building affects us. And also when you go into the broader, when looking more at our built environment as a whole. And I want to open the floor to, and also that's only not occupants, what the built environment affects, it affects also the planet and our environment itself. And I think this is that's also a lot of time missing on our conventional way of thinking about the built environment. Myself, the construction industry, we just do a set of plans, and we have a lot of things that we don't think. It's a great thing that the green building movement has brought in also the environmental focus. Now I think green building is quite mainstream, and I think the health and well-being part has always been a niche, also in the socioeconomic part. And I hope now that we need to concentrate more on that, and hope we can pick up with that. So I'll ask Meelan and Shalini if they have anything to add in terms of a linkage between the built environment and health and well-being from what Catriona has already said. Anything you want to add there? Don't worry, I'm not putting you on the spot. Huh?
No, I was just waiting to see if Shalini was going to take the floor. Shalini, go ahead. Yeah, I mean, I think Catriona gave us a really nice and broad vision of the different health impacts that a built environment can have. I think I'd like to add that a lot of these impacts are also very contextual. We do know that over the next 20 years, people will be living, they'll be living in urban areas. 70% of the global population will be living in cities and towns. And most of these cities and towns will actually be in Asia and Africa. So we have to start talking about how these health effects will be affecting these regions in a contextual way, knowing that 2/3 of the investments that are currently earmarked for urbanization of built environments in Africa have still not been spent and are yet to be invested. So I think that health and built environment provides an opportunity for not only better health in people, but also better health of the planet.
Thank you, Meelan, for this insight. Shalini, I apologize. The Zoom, I thought you could unmute yourself, but obviously not. Yeah, thanks, Meelan, for bringing that point. Shalini, you want to add on the linkage between health and well-being and built environment?
Yeah, I mean, I cannot agree more with Catriona and Meelan. It's more important now than ever to actually take care of our built environment. And now the fact that we're spending more time indoors, it really translates into how we bring in what's available in our workspace back into our homes. So it's a learning process, and everyone is adapting to the current situation and how this is going to carry over for years to come, what we learn during these hard times. So I cannot stress more how it is important to not just take care of ourselves when we get sick, but focusing more on preventative health. I think that's the big focus, more so with the well building standard and the strategies within well, is how much we spend after we get sick. So by using the built environment as a vehicle for real estate to make the real estate better, we can really focus on preventative health rather than spending our dollars after we get sick. So completely agree with everything Meelan and Catriona had to say.
Thank you, thank you. So let's now do like a dive into the 3 different frameworks but when we look at health and well-being in the context of a built environment. We start with Catriona. She's already been working for Better Places for People for quite a few years, and now World GBC has embarked on a buildings for people. Can you tell us more about this project, Catriona? Okay, maybe I should. I'm going to unmute. Yeah.
Of course. Let me pull up a couple of slides, and I would love to tell you about this project we're working on, the Buildings for People framework. Thanks, Tony, for the introduction. So I'm going to begin by putting this in context, and it's very helpful to have been able to show you a lot of the research that we have already done at the World Green Building Council that was really focused on demonstrating these links between health, well-being, productivity all over the world, as illustrated by these case studies I was highlighting. But with the steering committee of Better Places for People, who, as I mentioned, are in these 30 countries around the world, it's become evident from our network and from the feedback we're getting and from the way that we're aligning to the Sustainable Development Goals that we need to change and adapt and develop the way that we look and talk about health and well-being. So what I'm going to present to you is the future of health and well-being at the World Green Building Council, because we haven't released it yet. So this is work that is in consultation. So as well as presenting this to you, I'm also passing on an invitation for you to be part of the wider review panel, which Tony and the team at GBCM are also involved in. Now, just to bring us to life again, I'm sure many of you have seen the headlines of quite how closely the link between healthy buildings and coronavirus and indoor environmental quality and indoor air quality are coming to light. Particularly here in the UK, it's really grabbing media attention, and we've found that there's been a huge amount of feedback to us at the World GBC about our health and wellbeing project of people wanting to learn more about infectious disease transmission and the risk to the built environment. But now that's something, of course, that we wouldn't be able to give guidance on even if we could. We're following the World Health Organization and our national and regional governments because ultimately we don't know yet. But what we are recognizing is the impact of this pandemic, and perhaps a silver lining of this incredibly difficult time for us all is that we are seeing this increased attention on health and well-being. And so with that in mind, I'd like to announce the fact that later this year we will be releasing an updated framework for the built environment called Buildings for People. Now, this is really an evolution of an existing framework that World GBC published in 2016, but since we did that work, we've recognized the health and well-being industry has been completely transformed. And so as a result, we've been on so far a 1.5 year long consultation to co-create a set of core principles around health and well-being across the building and construction sector, down the supply chain, looking at entirely at the life cycle of buildings, to come up with a set of principles that we hope will be able to guide and influence and inspire the work of our network. So on the left-hand side of the screen, you can see the metrics framework that was released for retail buildings in 2016. There were a list of factors on the left-hand side, environmental factors, that were being used to identify and scope what healthy buildings are. But in terms of answering the question of why are we developing a new health framework, as I mentioned, we need to reflect this transition towards a holistic approach to sustainability, where We're not just looking at people alone, we're also looking at planet, we're looking at the economy. We need to address the 3 pillars of sustainability holistically, and then be able to link these ones that do have a direct or indirect impact on health, whether it's the occupant, whether it's the construction worker, whether it's the community, directly to these people who are being impacted by it. In terms of what the framework will be used for, we see it as a tool to equip the global audience that it will be seen by with high-level information. This is a conceptual framework. It's going to be used for education and for guidance and to share high-level topics across the network. But as Meelan said, this information needs to be contextualized. So that is what national and regional rating tools can add. We see this as a stepping stone for certification and to help to grow the health and well-being market across the world, so that then it helps to increase awareness of health and well-being, and we see it being really complementary to people who want to pursue other frameworks like health impact assessments, like building certifications like the Well Building Standard, national sustainability certifications, Fitwell, or many of the other amazing options that are out there. And so a little sneak peek of where we are right now. As I said, we are very much in consultation. So these principles are a first draft, which we expect will be shaped and molded by the time we release later on in the year. But we have been running a public consultation that, as I said, GBCM have been very helpful with. We're looking both at some of these traditional elements of health and well-being that were covered in our previous framework, and I mentioned before in some of the research that I presented. Within health and comfort, principles 1 and 2 were covering topics like air, water, light, acoustics, access to nature. With strategies, it helps us bring in things like active design, diet, hydration, that kind of thing. But on the right-hand side of the slide is the area I'm particularly excited about, because it's a new area under health and well-being at World GBC, for us to be looking at these wider health issues. Health in the community, resource efficiency and circular economy, adaptation, resilience and mitigation to climate change, health and well-being of construction workers, human rights down the supply chain, social equity and justice, and so many of these factors which, as we have progressed through the health and well-being journey in the last few years, it's become increasingly apparent from our members that the built environment can have a huge impact on these. So from a global perspective, we want to do what we can to highlight these and work with our national GBCs and with partners around the world to take this information and contextualize it and help to create, ultimately and hopefully, healthier built environments.
Thank you, Catriona, to have gone through here. And that's, for me, I've just followed also the development at World GBC, how it's transitioning from the set of indicators that you had or principles to like a sort of wider principles. And I just want, because the way what I understand how it works with World GBC is that there are some principles but that gets put on, and that normally get translated into rating systems, because rating systems have always been part and parcel of the strategy of changing and transforming the built environment. So Shalini, you're going to tell us more about the rating tool and of WELL, and also your how so it's moved from the version 1 to version 2, etc., and what you, and also later on when we come back is how the additional things that World GBC is looking at, and how do you think you will need to incorporate that in the rating tools. Shalini, all yours. Yes. Thank you.
Thank you, Tony. Let me share my screen. Okay, can you all see my screen?
Yep, that's good. Thank you.
Great. Thanks, Tony, and thanks, Catriona. I think you both set a good stage for me to introduce the Well Building Standard and how this really came to be. So my name is Shalini Ramesh. I'm with the International Well Building Institute in the US, in New York. And I've been with the organization for about 4 years now. Apart from my daily job, I do lead the India market and Africa. So it's great to see, great to really work with the Green Building Council Mauritius on this effort. I think we've already seen this slide in Catriona's presentation, but it's actually a good reminder how much time we spend indoors, and really understand that our environment is the largest determinant of our overall health, because as you all have already experienced, especially during these challenging times, we're starting to spend more time not in our offices, unfortunately, but at our homes, and really thinking about what we learn from our offices, how we can take that back into our home lives, into our personal lives, all this, and all the spaces that we frequent on a daily basis. And really thinking about what determines the state of health. Just because you're not falling sick, it does not mean that you're healthy. In the US alone, we end up spending most of our cost, most of our financial budget towards the end care versus the preventative care, like I had mentioned before. We know today that our health is based on far more factors than just our genetics. So if you look at this pie chart here, genetics is in fact the smallest portion of the pie that really impacts our health. And this is all this is according to the World Health Organization and the Center for Disease Control. The majority of what determines our health is based on the physical and social environments that we live in and work in, which means that both the built environment, like our offices, our homes, are designed, and also how we behave, how active are we, whether we smoke, what we eat each day. So all of these factors are the ones that really determine our state of health versus the genetics. And that's exactly what we at IWBI, the International Well Building Institute, are doing, where the Well Building Standard is the leading global tool for advancing human health through buildings. The Well Building Standard is aimed at connecting public health and building design, and also positioning real estate professionals as agents of public health. The Well Building Standard is also meant to improve performance, not just of buildings, but people, and better buildings and better people means better businesses and better organizations. So, and I think Catriona mentioned about this as well, where we focused a lot on the planet aspect in the last decade or so, thinking about all the green initiatives, how can we conserve energy, how can we conserve water, how can we do better for the planet. So this is really a second wave of sustainability, where we're thinking about this as a holistic approach, which really impacts both people and the planet, which are really the two pillars of sustainability at this point. Therefore, the Well Building Standard, which takes a holistic approach with people and planet, all the requirements within the standard is categorized into 10 big concepts. The concepts are air, water, nourishment, light, movement, thermal comfort, sound, materials, mind, and community. And the way the requirements work is we're not focused on energy conservation or water conservation. The requirements really talk about what is your air quality, what is the water quality that is being provided within your buildings, what kind of food is being provided. In terms of mind and community, what we're talking about is what is your connection to your broader community? What is your mental health policies? Do you provide parental leave for your employees? So those are the things that are covered within the Well Building Standard that range across these 10 concepts. And similar to other rating systems, I'd probably point out LEED and BREEAM. We wanted to keep the rating system straightforward, how the structure works with what the market is already familiar with. So the WELL version 2 of the certification program is a point-based scoring structure where projects can achieve between silver, gold, and platinum based on the points that the project actually pursues. The biggest differentiator for WELL, as some of you might know, is performance review and on-site assessment, which is to say that all the requirements like air quality, water quality, light, thermal comfort in a building, what is your sound quality, all this is actually performance verified by a performance testing agent who will come to your project site and measure all of this against the WELL requirements in the standard, and only then will the project achieve certification. Projects in Asia, here this is an example of a project in China where they've taken it to the next level, and this is where we see the future of WELL and performance verification going, which translates to ongoing monitoring. How can we get live feedback all the time and not have to do performance verification once a year? So projects in China have worked with Reset to really measure air quality at a regular basis. This is another example of a project that recently achieved pre-certification in India, which is a co-working space in Bangalore where you can see great biophilia, access to nature, daylight, a lot of great elements within the project. Another great example is, again, a more recently certified project this year, which is the Goldman Sachs office in Bangalore, again in India, which achieved WELL Gold certification. And I, in fact, had the pleasure of being in India earlier this year, toured the project, and the team has done a phenomenal job for such a huge project, which the project is about 1.2 million square feet, which is actually our largest interior project globally. So wanted to highlight that here. And WELL is a movement of leaders. WELL is global. WELL is not focused on any region. The standard is a global standard. So quickly to give you numbers, we have over 4,000 projects across 500 million square feet. And now in 61 countries. In fact, we were able to add 3 new countries in the last 5 weeks. The new countries are Morocco, Portugal, and Panama. Spanning across 11,000 WELL APs, either accredited, enrolled to take the WELL AP exam in 87 countries. So really this is a global WELL movement. And Catriona referenced to this as well, where IWBI and 9,000 over companies support the United Nations SDG goals. And as you'll see in the WELL building standard, we touch upon goal number 3, good health and well-being, the most. But you'll also see that the WELL building standard actually touches upon all the 17 goals in some way or the other through the requirements. And that brings me to my last point here, which is WELL portfolio. Why just think about certifying one building? Why just think about implementing WELL strategies for just one building? We should really be thinking about portfolios or implementing WELL strategies at scale. And why should we be thinking about this at scale? And I think the answer is simple. We would want to invest in our most important asset, which is our people, which leads to human capital management, increase in company real estate investment value, also ties into other reporting schemes like GRESB and ESG. So there are a lot of benefits as to why we should be thinking about this at scale and not just as a single building certification. Some examples of organizations who are already participating in this effort, where they have actually committed their entire portfolio to really implement WELL strategies. Portfolio is not meant to achieve well certification. Well certification can be a goal, but really how do you improve your existing real estate over time? And all these organizations have committed to improving their assets over a period of 5 years or 10 years. And if they achieve certification, that's great, but that's not the end goal. And lastly, being in the current situation of COVID-19, if you'd like to get involved with IWBI, we have a host of webcasts. You can stay informed through the task force, which we have convened to really develop guidelines around well strategies for return to work. And another great opportunity here is to become a well AP. As we're giving, we've lowered the cost of registering for the well AP exam during these times, so people can take advantage of that. And I'll close with saying that just yesterday, we actually launched this document which pulls out the strategies from the well building standard to really highlight what can support, what are the well strategies that can support in the fight against COVID through your built environment. So I'm happy to share this link where you can go ahead and download this 20-page document for your reference.
Thank you, Shalini. I know you got a lot to say and try to be as concise as possible. Thanks for sharing all those different elements, but what I would want to hear more about is the well communities. Maybe we can discuss that a little bit later. But now to Meelan. Meelan, you're going to speak to us more around health impact assessments and the wider concern of the built environment with health and well-being. You have done some projects. You have also worked at the Metro of Mauritius and how the health impact assessment of this. So tell us more about your work and also health impact assessment.
Yes, thank you. I'll just up my slides. Okay, I'm sorry. Can you hear me clearly? Thank you, Tony, for having me today on this virtual and lady-led panel, and thank you for everybody for listening and holding through the 3 presentations. I'm happy to be here. My name is Meelan. I'm based in Barcelona, at the IS Global Institute for Global Health, where we're working on health impact assessments in cities across the world, actually, focusing on urban health. So today I'll be talking quickly about some definitions in health impact assessments, proposing 3 case studies for you and 2 points on way forward. Some theory before, of course, we are addressing different components of health: social, economic, physical, environmental, but more first and foremost, considering health as a driver, an indicator, but also an outcome of sustainable development. In my talk, I consider a wider lens for built environment, as in that it encompasses physical features of urban spaces, which includes also transportation systems and urban planning. So it goes a bit beyond the narrative on buildings. What are health impact assessments? I'm sure a lot of you are familiar with environmental impact assessments, which uses a similar risk comparative approach. But health impact assessments actually focus on individual, socio and political, but also physical factors of the environment. It is an approach and method that can assess policies, programs, and projects in order to provide very specific estimates in terms of health. And this can be translated in diseases, as in morbidity here, or in terms of deaths. there are many values attached to health impact assessments, but one of the most important ones is equity. So this means that in addition to estimating impacts, we are able to actually look at the distribution of these health effects across different populations. This can be across minority populations or vulnerable populations or populations that are exposed to specific type of environments. In health impact assessment approaches, we also have the possibility to attach these effects to economic values, therefore providing some financial estimates of health damages related to specific groups of populations, but also exposure factors. This is a nice, colorful, and probably my only colorful slide about exposure pathways in urban and transport planning. We see here that policies impact on urban design, such as connectivity, accessibility, that this then leads to behaviors that expose people to different pathways, and these pathways actually impact on their health. We see here the pathways of noise, temperature, air pollution, but also some more indirect pathways such as stress and social contact. Morbidity, of course, can be expressed in different ways, different types of diseases such as cancers or cardiovascular diseases, and of course, in the worst of cases, premature mortality. I think for the built environment, we have touched upon different types of exposure pathways, temperature and waste, water quality, green spaces. There is a bit more that is being done on indirect pathways, such as social cohesion, violence. I think during this COVID period, we are seeing that mental health is extremely linked to the built environment. And so is inclusivity and the use of public open space. And these exposure pathways are very valid and valuable when we're considering health impacts. So we did some work on health impact assessments focusing on developing settings. We reviewed health impact assessments across 156 countries. What we do know is that health impact assessments are being practiced, but mostly in industrialized settings, when actually developing countries are claiming the burden of most environmental related deaths. We do know that between 80 and 90% of all deaths in the world related to air pollution, related to traffic deaths, related to physical activity are actually in low and middle income countries. So I selected from this work 3 case studies for you today, and I know that we have quite a strong Mauritian audience, and I hope that this will be relevant as well for you and your work. So the first case study where health impact assessment was actually used in the ground was in the construction sector, where they were looking at policies for improving energy efficiency. So they focus on the exposure pathway of air pollution related to brick emissions. And very interestingly, they saw that they could save per year near to 4,000 deaths, and that they could save 500,000 people from getting asthma attacks. In this health impact assessment, they also provided a very clear economic estimates and showed that they could save near to $3 million per year in coal savings if they were to choose a more efficient technology in terms of brick emissions. I think what's interesting here is that the health impact assessment is also led locally, so giving us quite some range to understand how the constructive sector is working in Bangladesh. Of course, of added value. The second health impact assessment that was worth mentioning in terms of built environment was a health impact assessment conducted in the Roma community in Hungary, which is a very vulnerable community facing a lot of socioeconomic pressures. So here they were trying to compare 2 projects, a project on the eviction of people living in a particular region, either putting them out of their houses on waiting lists or putting them in new housing. So the health impact assessment itself was useful to confirm that the health impacts of putting people in new housing, it obviously has more positive and beneficial effects, even if the financial burden is very high. But they actually managed to show that moving people into different zones would increase their mental health it would decrease the exposure to acute diseases. However, it wouldn't change their nutrition status, for instance, and their body mass index. And also it wouldn't change health-related negative behaviors such as alcohol consumption. So I think this case study is very valuable because it also shows that there is more than physical aspects to health and diseases that we can actually compute and estimate with health impact assessments in sectors such as nutrition and employment. The last case study is a Mauritian case study, and I think a lot of people will be able to identify with this one. It's a health impact assessment that we conducted on transport modes in urban planning and built environment. We saw with this health impact assessment that exposure pathways to pollution and physical activity, as well as traffic deaths, it could be helpful if we were considering averting deaths in a city like Luen in Mauritius. What we found in this health impact assessment is that averting deaths in the sector of the built environment could save the government nearly over 20 million USD per year, which corresponds approximately to 20% of all of the government spending currently on road and traffic congestion. So this health impact assessment was extremely helpful because not only did it look at different exposures, but it also provided economic estimates that is being used for policymaking. So I'm going to end with this because I had 7 minutes. So I hope I still gave you an overview. What are the way forwards for health impact assessment? I think the value and the promise of health impact assessment is now being really underlined with COVID-19, not only because of the transboundary health effects, and by that I mean that a local source can actually cause disease in a very distant place. This is the case for infectious diseases, as we're seeing here for COVID, but also for air pollution and for climate change. So health impact assessments are really helpful to looking at these transboundary threats, but also they're helpful to address some myths, and I think there's now growing consensus that obviously health is the responsibility of non-health sectors too, and health cannot be only seen as a co-benefit but also as an opportunity for cross-sectorial work, which is why I'm here, and definitely seeing the health impact in areas of the built environments and areas that impact the built environment, such as transport, housing, and nutrition, within the way that humans occupy their space. I think the second myth that is really helpful here, and that health impact assessment help, is that most people think that analyzing health data will slow down or jeopardize a project. Health impact assessments now are being multiplied in places and settings where there's very little data and constrained resources. However, the use of technologies and rapid assessment tools are helping the multiplication of these estimate procedures. And I think that it's worth mentioning that countries such as Bangladesh or Mauritius actually are conducting health impact assessments that are useful to benefit people and planet. So I'll end with this quite wide statement on environment, but true, that environment is not only an abstraction, but it does represent quality of life and the very health of human beings of generations unborn. Thank you. So I'm here for questions, and I hope that you'll have some. Thanks.
Thank you, Meelan. Thank you very much for giving us an expose or a little aperçu of the health impact assessment. And what actually strikes me is that we always have to bring things with money, and I think that's what speaks to everyone. And where it was interesting to see also in terms of we can avert like 4,000 deaths, and that speaks more to me, but unfortunately for policy it's a lot of money. I just want to thank Catriona. She needs to dash. Thanks so much, Catriona, for your time, and apologize also that things just went a bit out of time here. We will not discuss more, but we'll have you again in one of our webinars so we can and take this forward and discuss more. Thanks, Catriona. Thank you. So yeah, as mentioned, I think there's been some issues regarding time with this, but I just want to discuss a bit more regarding now about like a few minutes, and then we can give questions to the floor. I've seen a lot of questions coming in, so I'm just looking at now very quickly in terms of the way forward. I understand that people, how do you, for example, Shalini, how do you sell people using well? How do you go about convincing people? I see that there's, Catriona spoke at the business cases. You try to say that, oh yeah, there's more productivity, or you sleep better. I mean, what is really like one sort of anchor point, but that sells? Is it just economics, or?
That's a great point, Tony. And I have to say, starting with this COVID-19 situation, I think we all realize how important health is and how important built environment is. So really at this point, it comes down to educating the building occupants, especially with the current situation, why air filtration is important. And that's one of the bigger requirements in the well building standard. Why hand washing is important. That's already ingrained in the standard. Why mental health is important. All of us are confined with physical distancing. I won't say social distancing, because we are trying to be as social as possible with the current situation, but we're physically distanced, which means to say that we no longer have to convince or educate people, because people are becoming more and more aware now that this is important in the built environment. But in the past, really the business case comes down to which organization is willing to provide this for their employees. And more the employees are asking, if my employer does care about me. It's no longer just about, okay, I like my job, I'm going to work for this company. It's about what benefits is a company providing to its employees. Are they taking care of their employees and the employee family? What are the parental benefits? What are the sick leaves? All that is definitely something people who want to work for a company ask for. And they take pride in that environment, because when you walk into a well-certified building, you can immediately see you can feel the air quality, you can feel the amount of daylight that comes in, you can see the biophilia, and all that indirectly translates into productivity, which translates to less absenteeism, which again translates to dollar amount for the company. So every company, the baseline is different. I don't think there's a business case or one business case that fits all, because every company starts with the different benefits that they provide to their employee, and what does that look like. And yeah, that's really what the business case for well right now is. And yeah, I don't know if I've answered your question, but that's really how organizations are leveraging well. And we no longer have to take the business case out there. In fact, people are asking us, how do we do this? Can we do this? We need to do this more than ever now. How can we get started with implementing well strategies for our buildings? So yeah.
That's great. Thanks, Shalini. So I should be doing my exam, my well exam then, so I can be an AP. I've done the course a few years back. Yeah, I just want to, thanks Shalini. I just wanted to ask to Meelan, in terms of health impact assessment, how's the demand for such a study? I mean, is it just researchers doing this? Is there a lot of demand for governments to be asking for this type of study for policy making, evidence-based policy making, or is it just academic research? Because it's very important for me, I think, talking about benefits in terms of saving human lives. How do you actually put a figure on human lives? And yeah. So, what is your experience regarding that, Meelan? Because I think to obtain data and more health impact assessment, the more data we have, the more we can take decisions around policy. So, yeah, what is your take on that?
Yeah, thanks, Tony. I think that what's interesting in what Shalini was saying, and I think how this relates to health impact assessments, is that it's important to be able to assess the impacts of a project, like a building or a compound, but also be able to assess the health impacts of a policy. And I think this is where health impact assessment is very useful, because by assessing policies, we can actually implement scenarios that are not only real time, but scenarios of how a policy would actually create a new environment in 10, 20, or 30 years. So there's three components to this. The first is obviously the modeling. A lot of the health impact assessments are quantitative modelings, so it demands not only data, but also some level of technical capacity. And to answer your question, no, it is not only restricted to the academia. A lot of governments, and actually mostly governments in OECD countries, are actually leading in insight health impact assessments on public policies. So it goes beyond only private investments in projects. Now in developing countries, in the rapidly urbanizing developing countries, where there is a lot of finances earmarked in development projects such as dams, road infrastructures, these projects are either led by multilateral organizations or led by private sectors. They also conduct health impact assessments, and they're actually extremely well conducted, very methodological, and just as valid as any academically led health impact assessment.
So as for example, as a citizen, how can we ask our government to do that? I mean, it must depend on them to do that, or we can ask them, yeah, we want to see some health impact assessment regarding your policy. How does that can go about it? Is it just voluntary from government, or we can have also some social pressure?
I think it's interesting to look a bit at how health impact assessment legislation has been imposed in different countries. And again, this is not about standardizing the approach, but actually making it more accessible for different counterparts and stakeholders. In Thailand, for example, they have instituted a legislation for health impact assessments, and different groups of people can demand for one, and citizens are actually a group of people that can demand for a health impact assessment in Thailand. So I think that the multiplication of health impact assessment leads to better legislation, and it leads to implementation of routine practice of impact assessments. Now the question is, how do we not make the same mistakes, or how do we not face the same challenges as in environmental impact assessments? That is, yes, okay, it can be mandated and enforced by policies and by local governments, and on demand from citizens, or on demand from private project investors. But then how do you actually make sure that the recommendations are implemented and actually change in the field?
Thanks. Shalini, I just wanted to ask you, because when working in the, thanks Meelan, when working within the building industry, rating tools always been something but pull regulations. So do you see, in terms of the criteria and the aims of objectives, say about nourishment, having like signage for what type of food you can have at the canteen, or you not having like a lift and having people have to take the stairs? I mean, do you see any of your aims and objectives and criteria translated into regulations? Like, for example, in terms of green building, when we look at environment, we say, okay, you need to be that energy efficient. And then we see, oh, the law has changed, and now energy efficiency is just something we need to do. I mean, did you see that there's been an impact on the rating system, like pulling regulations on health and well-being, maybe including some of the things that you recommend in terms of regulation, building regulations?
I would answer this saying yes and no. I think partly because with energy and environment, it's a little easier to quantify when it comes to saying, okay, this X percentage has to be your energy savings, or we have to reach to net zero. But with health and wellness is, I believe, is very subjective, and how organizations implement health and wellness strategies within a building can be very different. It may be the same requirement within the well building standard, but how organizations actually approach that could be 10 different ways to approach a certain strategy. But I won't say no, because organizations have the power to actually make this into policies more than at the government level. Now, at the government level, they are looking at, for example, GSA is looking at across all their assets. But for organizations to really make this as a policy, for example, Deloitte a few years ago said, we're not going to move into a building unless it achieves at least a minimum of well silver. Now, that's a bold statement, and that definitely becomes a policy for Deloitte as an organization to say, I'm not going to move into a core and shell unless you can show me that it's met all the well requirements. So on that level, yes, it's already becoming a policy for several organizations, for several large organizations. And especially with the portfolio approach, both for developers and tenants, where we're not looking at a single building certification. We're looking at implementing well strategies at scale, which means that certification can be an incentive, can be a bonus, but well is no longer focused on just having a building certified. We all know that our majority of our real estate is existing buildings. So we can implement well strategies for new buildings, which probably is a no-brainer at this point, with well being around for over 6 years now. But how do we really improve our existing buildings? And that's where organizations making this commitment to implement well strategies at scale becomes really important. So we can actually provide better buildings, not just for employees working in a specific building just because it's a new construction and they have the opportunity to work in that new building. Organizations don't want to do that anymore. They want to make sure that they implement it across scale, across their portfolio. And as you saw, like Barclays, Uber, now Deloitte has made that bigger commitment. So as organizations start making these larger commitments through the portfolio program, it automatically becomes a larger policy that governments can adopt. But I will say there's no one size fits all to achieving well features. Every organization can do it differently, as opposed to meeting the energy or water conservation requirements.
Great, thanks, Shalini, for this clarification. I've just had a look at the list of questions, and most of these questions, first of all, the recording will be sent to you. If you registered, that will be sent to you, so you'll be able to get some of the information, because some of the questions here are about some things that have been presented. So you'll get the presentations, we'll send that to you, no worries. And some of the questions also are more regarding well. So you've sent already the link to the well website, and we can get information there. So I don't think we should be, excuse me, audience, some people who ask about the well, you can find this online. We just want to make the time, as valuable as possible. So if I could maybe have some other questions. Okay, I work with remediative strategies and I wish that my work became obsolete. I'm looking for a way for quantifying not just the money, but the value of life and the number of deaths incurred by one decision, whether in regarding the company, like you mentioned, policy. I think it's just a comment. This is not, it's not, the question is how the decision of one person might enrich one, but kill 10 to 20,000. So I'm not quite, I think this is just a comment also. Not to say any specific names, but a lot of the big companies in Mauritius are not willing to make a change towards people, healthy, sustainable infrastructures. How do we convince them otherwise? I mean, that's what I think we've touched, we can refer them to well, and you don't have to give me a commission. So I think now we understand that today we understand that there are some frameworks that exist in terms of looking after your health and well-being. The reason why we started doing, say, green building certification and teach and give knowledge around that is mainly it is like a reference document where people can look what is important, for a green building. But now in this case, we can look at the well-building standard and understand what is important. We need to look at the air, the light, the nourishment, the mind, community. So with that, you can understand what are the objectives, and then can understand also what are the strategies you can put in that. I think it's a big thing. And with new 8 principles, that actually is getting a bit broader. And do you think, Shalini, you will be looking at broadening the health and well-being to look more outside also? I've seen there are some things in communities, like, for example, the public use of a private area, affordable housing. Can you tell us a bit more about this thing before we close? And how do you look more above the building, more at the communities, and more at socioeconomic impact? Because obviously the livelihood of people, or their it links to the well-being and links to the health.
Yeah, definitely. So the well community standard is built upon the well building standard, but also scaling across communities. So the community standard really talks about how individuals can impact in the physical spaces. How do they connect with their larger community? So we have several multi-use developments that are pursuing well community, in addition to the individual buildings within that community pursuing the well building standard as a certification. We have, in fact, a senior living community in Thailand that's pursuing well, where the individual buildings all are going for the well certification, but as a community, they're pursuing the well community standard. So there's definitely linkages, but both the community standard is built upon the well building standard, which extends not just from one building, but across a community, a defined community. And talking about other sectors, the well building standard not only caters to offices, but also residential. And in fact, there's a big emphasis on senior living, and we have several industrial projects, which over the last 2 years has really started thinking about health and wellness for industrial workers, which I believe at this point in time where e-commerce has been very high in demand, how do we really cater to those workers in the industrial environments? We also cater to affordable housing, education. So well really is, we're not just focused on offices, but really expands across all the sectors, even including healthcare. The Thailand senior living project that I mentioned about also has a healthcare building, a high care building in their community. So it's really a very different community, which kind of has luxury senior living apartments combined with community center and a healthcare project. So yeah, so we definitely have a lot of opportunities here with the well building, with the well strategies.
Thank you, Shalini. To pen off or to end the webinar, I would ask both of you, what is the one thing you think is needed for us to have a better built environment? What is one key thing you think will drive us to have a better built environment, which is going to be look our health and our well-being? Meelan?
Yeah, I think, Tony, before I answer you, I'll just say one comment. I think I've been looking at the questions. Yeah, I mean, the health impacts of built environment can be estimated in terms of death, and most times it is. The statistical and economic value that is attributed to deaths is one way that we then bring health impact assessment outcomes to policymaking, because human deaths are very difficult otherwise to estimate. The different ways that people have been doing that is through the value of statistical life, or using units such as disability adjusted life years, and these years of life lost. So I think this responds to a couple of questions in the chat. I wish I had more time to talk about the deaths that we've seen in the health impact assessments, and also the diseases. And now to answer your question, there's then a question about COVID-19. There has been some studies showing that obviously the lockdown has decreases air pollution levels, for instance, and showing that 25% decrease in air pollution is actually saving nearly 10,000 deaths, which is, in China, for instance, more lives saved than deaths related to COVID. So I think this really does impact assessment methods for us understanding what are the thresholds and what are the pros and cons of pandemic measures. So yeah, I think to end on your question, Tony, I think that we should be using different units and using different communication ways to bring health to the agenda of non-health sectors. And I think built environment is an opportunity for that rather than a barrier. So yeah, thank you.
Thanks, Meelan. Shalini?
I think I agree with Meelan, and I also want to point out back when Catriona pointed out the case studies in the Green Building Council reports that they release, which really talks to the value in terms of health. It's just not about the value in terms of dollar amount saved and how fast can you really see your ROI, but it talks about, before we go to deaths, it talks about absenteeism, presenteeism, productivity. How do you bring back all your, if your office is a well-certified building, that itself is an education tool where you bring back some of those to your home. As an example, we all are working from home at this point, and IWBI has a well-certified office in New York, and we have so many amenities that we actually brought back some of that to our homes, like biophilia, making sure we have daylight, making sure we go on regular breaks during our endless Zoom meetings during the day. So I think it's not just about seeing the dollar value, but also educating all of us as to why this is important and how can we feel better even during these challenging times. Stress management, mental health management. So yes, to our point, we can measure this by deaths and reduce in sick leaves in organizations. All that is definitely quantified through the case studies, but also how can we use this as an education tool to live a healthier and hopefully stress-free life.
Thank you, Shalini. So what I pick up is this communication also and bringing the health discussion into non-health sectors like built environment. I think RWI is doing a fantastic job. And also us, we've always been pushing to look at socioeconomic health and socioeconomic factors when we talk about building. And yeah, I want to thank everyone for staying 5 more minutes than expected. I want to thank also our panel, which has been great to have you to take time from your busy lives. And Shalini, for you, it's like right in the morning, you just woken up and you're all like fresh speaking to us. Meelan, also thank you from Barcelona, and Catriona, who had to leave us. Yeah, a big thank you. And for first webinar, I'm very happy how it went. And we hope also to have you again, either as panelists and speakers, but also as participants in some of our webinars, because we're going to start doing some webinars, more of them, since we all confined, and we all now very used to all this video conferencing live. Yeah. Thank you very much, and go well and stay safe, and hopefully through this webinar you know a little bit more about health and well-being related to the built environment, and you can also be the people talking about it and demanding it and be like change agents. Thank you very much, everyone. Goodbye.
Thank you, everyone. Bye.